Now, as you just heard, an assessment team down at LPIA is ensuring all goes well on the health side of things. The overall idea to minimize the prospect of COVID-19 entering the country. As Deputy Chief Medical Officer Dr. DeLon Brennan explained to us, a lot of checking is really done before travelers actually enter the Bahamas. That includes supplying health and tourism officials with crucial information like where they're coming from, where they're headed, if they've had the appropriate PCR COVID-19 testing done.
However, at the point where people actually come into the Bahamas, having passed that part of it, we have at Lynden Pinning International Airport, we have our team of nurses available. But the team is not just made up of health personnel, it's made up of immigration personnel as well, it's made up of tourism personnel. So what really happens is that when persons land, they will then come to immigration. They will present their paperwork to say, I have a health visa, so I've been authorized to travel to the Bahamas. I have my test results that have been checked ahead of time, but I also have them in person with me as well. And then once they present those, if there's any challenge with those, if someone ascertains that they don't feel as though they're legitimate, or if there's a concern specifically, or they may do random checks, that's when they call in the health personnel in order to do checks with that person to make sure things match up with what they've said.
Dr. Brennan assuring that this means not everyone coming in needs to be checked for COVID-19. In the event, though, that someone has symptoms suggestive of COVID-19, here's what happens next.
If they have shortness of breath, if they have, muscle aches, they appear fatigued and tired, then they will go on to a secondary screening process. We have an isolation procedure and an isolation facility at the airport, at Lynden Pinning International Airport, in order to do those screenings as well. However, what we do know is persons aren't just coming into New Providence. They're going to our family islands and like as well. So we have the same procedure in place in our family islands as well. Our family island personnel, immigrations, customs, healthcare personnel are to identify a particular location where the expectation is that they will let the person know that we see that you have symptoms, we're concerned about your health, and we're going to have our healthcare personnel evaluate you, and they would put them into that isolation location until healthcare personnel are able to do so.